Hello everyone, so today I'll be giving a brief review on acute pulmonary edema. It is the worst and most serious manifestation of congestive heart failure. It occurs when pulmonary hydrostatic pressure is more than pulmonary oncotic pressure. So basically in any vessel of the body there is two types of pressures: hydrostatic pressure and oncotic pressure. The oncotic pressure aim is to keep the fluid inside the vessel. So whenever there is decrease in oncotic pressure, either due to any protein losing enteropathy or any sort of disease which causes decreased protein in the body or albumin in the body, or any disease which increases hydrostatic pressure, then it will lead to edema. So here in the pulmonary vasculature, when the hydrostatic pressure is more than oncotic pressure, it may lead to pulmonary edema. So the patient will have fluid in the alveolar sac, so there will be decreased gaseous exchange, and the patient will present with sudden onset shortness of breath, tachypnea, orthopnea, and pulmonary crackles. Oxygen saturation will be less than 90% on room air. Chest X-ray finding of pulmonary edema can be memorized by using mnemonic A, B, C, D, E. A for alveolar edema, which is bilateral perihilar opacities and they look like bat wings, therefore it's known as bat wing sign. B is curly B lines, interstitial edema. It is thickened edematous interlobular septa and it is seen in interstitial edema or pulmonary edema. C for cardiomegaly, D for dilated prominent upper lobe vessels, E for pleural effusion. So this is bat wing sign. You can see there is perihilar opacity and it looks like a bat wing. These are the curly B lines pointed with red arrow, and these are thickened edematous interlobular septa. So the prominent upper lobe vessels include prominent azygous vein, you can see peribronchial cuffing, curly B lines, right pleural effusion which is obscuring the costophrenic angle. We can memorize the treatment of acute pulmonary edema using mnemonic LMNOP. So in patient with acute pulmonary edema, we will give loop diuretic, which is furosemide, 50 to 100 milligram IV. It will decrease the pressure caused by excess of fluid in the heart and lungs. Second is morphine. It decreases symptoms and it decreases afterload. So the symptoms of pain, it will decrease, and afterload. So what is afterload? Afterload is the amount of pressure that the heart needs to exert to eject the blood during the ventricular contraction. So the more the pressure, the more the force the heart has to apply to eject the blood. So by decreasing the afterload, what will happen? The cardiac output will be increased automatically. How it will work? Because we are decreasing the pressure that heart has to put for ejection of the blood. So when the afterload is decreased, the heart will be easily able to push forward the blood into the systemic circulation. So what will happen? The pressure on the left atrium will also be released, that is, it decrease, and due to left atrium pressure decrease, automatically the pulmonary vasculature pressure or the pressure on the lungs or the pulmonary edema, it will also decrease. So the morphine help in decreasing afterload. Third is N for nitrates, IV glyceryl trinitrate, 10 to 200 microgram per minute. They are titrated upwards every 10 minutes. Titrate until there is clinical improvement or either systolic BP falls to less than 110 millimeter of mercury. So we have to maintain the blood pressure also in the treatment of pulmonary edema. High flow, high concentration oxygen is also required. Non-invasive positive pressure ventilation using CPAP of 5 to 10 millimeter of mercury by a face mask results in rapid improvement of shortness of breath and other symptoms. Position: sit up the patient also decreases the preload and afterload. So it will have the same impact on the heart as the morphine has. If all the treatment which I have discussed does not show any response, then you have to consider inotropic agents. Example, dobutamine, especially in those patients who are hypertensive. Intra-aortic balloon pumping is another option, especially in patients with myocardial ischemia. It will reduces afterload, and same will happen that due to reduction in afterload, there will be help in maintaining the cardiac output easily, and it will decrease the LA pressure and improves the pulmonary edema. So that's it. I hope you learned something from it. If you do, please like my video and subscribe to my YouTube channel. Thank you so much.